Welcome to America's Heroes Group Roundtable Livestream Digital Media Show. Today is Wednesday, December 4th, 2024. December is AIDS Awareness and National Human Rights Month. Remember to pay attention to these two pressing issues that we face every day. I am your host, U.S. Army Flight Surgeon and Iraq Combat Medic, Colonel Dr. Damon Arnold. And I have two esteemed panelists today from the Jesse Brown VA system. It's a wonderful institution. They do a lot for veterans every day. Our first panelist is Dr. Augusto Alonto. He is a medical director of infectious prevention and control at Jesse Brown VA Medical Center. Dr. Alonto is also an associate professor at the University of Illinois College of Medicine and was involved in clinical research to determine the safety and efficacy of COVID vaccines. We also have with us Catherine Dell. She is a nurse practitioner and a lung cancer screening coordinator at Jesse Brown VA Medical Center. Beginning in 2019, she established a comprehensive lung cancer screening tracking program at JBVA that now screens 3,000 veterans annually. She is also a member of the VA's National Center for Lung Cancer Screening Advisory Board and helps implement VA lung cancer screening programs across the country. Today's discussion is the JBVA National Influenza and Cancer Screening Week. We are going to first start with Dr. Augusto Alonto, who will discuss the flu, COVID, and the importance of vaccinations. So, Dr. Alonto, why is it getting vaccinations so important?
Thanks for having me, Dr. Arnold. It's important. We recommend vaccines throughout our lives to protect against many infections, including the flu, COVID, and in young children, many other types of infection, including measles and other infections. And vaccines are as important to our overall health as much as diet and exercise. They can keep us healthy, and in some cases, vaccination can mean the difference between life and death, such as when COVID was rampant. And then, most importantly, when we're vaccinated, our loved ones are also vaccinated, including our children and our elderly parents and grandparents. So that's so it's important to get vaccinated.
Yeah, and there's a general misconception out there. And some people feel that COVID or flu vaccine can give you the flu or COVID infection. And, maybe you can clear that issue up.
Yeah, so I mean the flu vaccine and the COVID vaccines they don't get us the infection, especially the COVID vaccine. They're not live vaccines. What happens is after we receive the infection, sometimes there can be some mild side effects such as pain around the injection site, and maybe even having a fever soon after we get the vaccine. But that only means that our immune system is revving up to protect us for when the actual viruses try to infect us.
Yeah, I love it. Because so if we get vaccinated, we're actually protecting people in our family, people in our community, our coworkers and friends, right?
Yeah.
So, but what if someone's allergic to eggs? Can they still be vaccinated?
Yeah, so the short answer is yes. There have been studies that have shown that people with egg allergies can receive the influenza vaccine safely and without side effects. Many years ago, we used to say that, if you have an egg allergy, then maybe we shouldn't give you the flu vaccine, but that's been debunked. There's been a lot of studies showing that it's safe even for people with egg allergies.
Yeah, because one of the correlates of that also is a real, deeply held misconception, and it was actually based on faulty research about thiomersal and its linkage to autism. Maybe you can talk about that for a brief moment.
Yeah, again, the link between vaccines and autism has been debunked by many different studies, and so whenever my patients ask me about that, especially parents who have children who get these misinformations from the internet or what have you, but it's been debunked. There's no link between vaccination and autism. I have children. I have them vaccinated whenever they, every year.
Oh, fantastic. Yeah. So you not only preach it, you practice it too.
Oh,
It sounds
definitely, definitely. My children don't like to get vaccinated because they don't like the shots, but
yeah.
we make them.
Well, who should get vaccinated for the flu?
So basically, everyone over 6 months and older should get the flu shot every year. And it's even more important for people who are at higher risk of serious complications from the flu, like the elderly, those with heart and lung disease, those with cancer, and those who are taking medications that can weaken the immune system to receive the yearly flu vaccine, and even COVID
Okay.
as well.
Mhm. Yeah, yeah, because I had one of my deputies when I was running the Department of Public Health for Illinois. I had to take her in to get hold her by hand to get her vaccination. So she brought it up again in her 60th birthday party for some reason. This was many years ago, but she still remembers it. And she said, "Thank you for holding my hand for
Yeah,
taking me there." But she said
yeah.
she really lived through it. It was not as bad as she thought.
Yeah. And it's
But
not too
what
late.
about?
Oh
Mhm.
yeah, it's not too
Yeah,
late to
that's a
get the
good point.
it's to get the flu
So
vaccine. It's the holiday season, so we get to see our loved ones towards the end of December and maybe even New Year. So if you haven't gotten your flu vaccine, now is a great time to get it. So yeah.
yeah, and gone to the VA, to get my vaccinations, and sometimes they'll offer you more than one vaccination. Is it recommended to get vaccines at the same time, or what's the procedure for that?
Yeah, so usually around this time of the year, the main vaccines that we give out to the veterans or to the and their families would be the flu vaccine and the COVID vaccine, and you can get it together. There are some vaccines that you can't get together, so you'd need to talk to your doctors if you need those vaccines as well. But for the flu vaccine and the COVID vaccine, they can be given at the same time.
And then some people say, well, I already had COVID, so why should I get the vaccination again? And so they don't really understand what's going on with these different, variants.
Yeah, that's a great question. It's important to receive the most updated COVID vaccine that's available, and the reason for that is the latest COVID vaccine will protect you or protect us from the most common strains circulating in the community at the present time. So the virus that can cause COVID, they can mutate, and when they mutate, then the old vaccines don't work anymore, and that's the reason why we get updated vaccines from the CDC. Is that so that it can protect us from the common strains circulating in the community at the present time?
Boy, they really do a good job protecting us. I remember, back in time where they protected us from actually having an Ebola outbreak, and people don't realize how effective these vaccines are and how they protect us every day. As we go about our business, we go traveling, we go to stores, we meet in big groups. And, so it's really good advice you're giving. I think everyone should take heed to it and make sure they get vaccinated. And I'll come back to you in a moment. But I'm going to move on to our nurse practitioner, Catherine Dell, and who will discuss the fact that lung cancer screenings can save lives. It's a fact. So, what is lung cancer screening and why is it important?
Well, thank you so much for having me. I love talking about lung cancer screening every opportunity I can get. Lung cancer screening, it's a type of cancer screening um, where we are trying to find cancer when it's early and small and curable. So I think a lot of people have heard of other types of cancer screening, like mammograms for breast cancer, prostate cancer screening, but not a lot of people have heard about lung cancer screening. So what it is, it's a scan that we do of our lungs once a year, and we're just looking for any sort of changes that might be early cancer. And why it's so important is lung cancer is really tricky. It's a type of cancer that doesn't cause any symptoms until it's gone really out of hand and is very difficult to cure. But if we can find lung cancer when it's small, we can really cure it. And so this scan, if it's done every year, we can find cancer when it's very, very curable and small. And hopefully we can save more people this way, because lung cancer actually, it kills more people than breast cancer, colon cancer, and prostate cancer combined. So it's a huge problem, and screening can really make a huge difference.
Well, I can see I'm going to have the two of you back on again, because one of the things that I really am a strong advocate for stopping smoking. So let's try to get rid of the problem at the source.
Exactly.
But who should get lung cancer screening?
Well, that's a perfect segue to who should get lung cancer screening. So people that are at high risk for lung cancer, and right now it's approved for people that have smoked most of their life. So for people 50 to 80 years old and have smoked what they call 20 pack years. So that's like smoking a pack a day for 20 years or a half a pack a day for 40 years. And it's also not just for active smokers. If people have quit within the last 15 years, they're also eligible to get lung cancer screening. So that's the population that we're looking at right now, are the people at the highest risk for lung cancer. And unfortunately, there's a lot of veterans that smoke, and you're right, we should, cut that habit out. But there is this option for people that have, unfortunately smoked most of their life. And this is a good kind of safety net to hopefully, so lung cancer isn't a big issue for them.
Yeah, because I remember back in 2008 when I was the director for the Illinois Department of Public Health, one of my greatest accomplishments, really great, was pushing the Smoke-Free Illinois Act through and making sure that we were protecting citizens, because secondhand smoke, children with asthma, other people suffer the consequences of people who are smoking around them. And so, are there any downsides to getting scanned though, or what is a scan like? How's it getting a
So
scan?
yeah, a scan, it's a really simple procedure. It's non-invasive. It doesn't hurt. It only takes a few minutes to go through the CAT scanner machine. Basically, you would lie flat on your back and you go through like it looks like an open donut, but it's not in an enclosed space. Some people get worried that they might feel claustrophobic, but it's really an open scanner. And it only takes about, a few minutes to complete the scan. So it's pretty simple, and doesn't keep your clothes on. It's pretty a simple procedure. The only downsides, it's an overall very safe, painless procedure. The downsides are it is a scan that uses some radiation, so you are exposed to small amounts. We do use the lowest amount of radiation for these scans. And also, it's not uncommon for us to find spots in your lungs, and sometimes these spots are not cancer, but it can cause some false alarms going off. And so some people get really worried and anxious when they find out that they have these spots in their lungs, and they turn out not to be cancer. So that's not that's something that can happen too.
Well, it sounds like it's better to be safe than sorry. If
Yeah. Yep, exactly. It's also sometimes it's I always think it's better to know than not know. And it's also, I've had some people say, well, I had no idea I had these other lung problems that we see. So it's a good kind of check of the whole chest area.
Yes. Well, how does someone sign up for lung cancer screening at the VA?
So the first step is to talk to your primary care doctor. They'll be the best person to see if you're an eligible candidate for lung cancer screening. And it's just good to talk to your doctor about your smoking history. And there may be other options too for screening. So that's the first step. And then they will arrange a CAT scan. And that's kind of how the process gets started. And then every year around that time, we'll have you come back and get a scan, because it doesn't just stop with one scan. It's something that we want to keep an eye on over time.
Oh, fantastic. So you're actually tracking them to make sure that nothing develops over time. So they
Exactly.
feel
Yep.
so have a greater deal of safety. Because one of the things is that if you find something early, as you were saying, you have a greater chance of finding being cured from something that may be there if you get in really early stage, and it can prolong your life, or it can actually be a full cure. And one of the things that people don't realize is that impacts your family, your children, your spouse. It has a devastating impact on your survival, whether you're going to get Social Security for till you get older, or whether you're going to be dying younger than you really should, for no reason other than not going in for a scan or being checked. So it's really important that I think people, who are the veterans, really listen to this and come in and get their care. And that's the general population really needs to be considering it as well. But so let's go back a little bit and talk about this the vaccinations and that kind of thing. Maybe you could tell me some success stories, because you're an infectious disease expert, Dr. Alonto. Um, I know you've probably been up 24 hours, 72 hours watching a patient, going through infectious disease process, and trying to figure out which organism do they have, and can we use antibiotics. And one of the things that I heard over and over again was when people did not choose to get vaccinated for COVID, is that they started asking for it when they were being placed on a ventilator and it was too late. And so people need to hear these stories, that those are some of the risks you're taking as well.
Yeah, when you started talking about success stories, the first thing that I thought about that that's happened recently is the COVID epidemic, and the reason is prior to having the vaccine for COVID, when the epidemic started, people were dying. I've seen a lot of patients die here at the VA in the beginning of the epidemic. And that was when we didn't have the vaccine. But after the time that we got the vaccines for patients, that was when we started seeing less and less deaths. And the impact of the vaccines was seen greatly in the elderly population, people who had heart disease, people who had lung disease, people who had cancer, basically a lot of the people who were also veterans. And so we always encourage our veterans to get the vaccines, not just the COVID vaccine, but the influenza vaccine, because the flu also kills millions of people every year.
Yeah, and it was really kind of strange because some people, sort of made a distinction between getting a COVID vaccine, and because I would ask them, well, didn't you get measles, mumps, rubella, diphtheria, tetanus, your boosters, and oh yeah, but that was a long time ago as a kid. And I said, well, you're still here.
Yeah.
you know, and these vaccines are not made because there was a mystique around it initially, and there were some things people were saying, and so this mystique was that it was developed very rapidly in such a different, radical way, different from what was done before. But it was actually based on scientific principles, were really rigorously tested and followed and implemented to develop this vaccine. And I remember the Tuskegee experiment always comes up, and it's not an experiment. I always tell people it was a study. An experiment is when you intervene. A study is when you follow people. So, by not taking the COVID-19 vaccine, they were actually putting themselves at risk for becoming part of a Tuskegee study, because you had something that you can intervene with, like penicillin for syphilis. You had this vaccine that could stop you from getting a disease. So it was really kind of a lot of the misinformation and disinformation that's out there. I think people have to be very, very careful and listen to people who have expertise, such as yourself and such as Catherine, when they're looking at these different issues. So, what would you say as far as the lung cancer screening? How's that going overall? And have you seen people, actually benefiting from this and the peace of mind maybe that they're getting?
Yeah, I think more and more people are aware that lung cancer screening exists. I feel like I see billboards now and things in the general public too. And
Mhm.
also, VAs across the country have really expanded access to lung cancer screening. And now most VAs have lung cancer screening programs that people can get screened in. So it really has, in the 5 years I've been at the VA, it's just exploded in the numbers of people getting screened. We still
Right.
have a lot more to go. I think there are a lot of smokers out there that feel like, oh, I've done this to myself and there's nothing I can do to help myself
Mm.
now. But there really are, there's so many things that even if people have maybe not made the best decisions with smoking throughout their life, there's good positive things that they can do for their health that can really improve their futures.
Yeah.
And I see that all the time. I really, there's so many success stories where we'll find an early small cancer
Wow.
and we can talk to them and be like, we found it, it's small. Sometimes it's even just this tiny little spot. Um, and they can have surgery, have it removed, and they're
And live.
cured. Yeah.
Wow, wow. That's really a beautiful story, because then they, are able to still interact with their families and have a life and show up for a wedding and for, a Christmas or, Hanukkah or any other the many holidays that we celebrate that we take for granted sometimes being present. And so that's really a wonderful thing, especially this time of year that really rings home. No pun intended with bells.
Yeah. And
But
I think those people, they also do a good job of telling others that, this exists and that's a good thing. I think there's so many people that have had family members pass away from lung cancer and remember what that looks like. And it's so different now that we have lung cancer screening and, the outcomes can be very good. So that's the most hopeful thing with lung cancer screening.
Mhm. Well, what do you see as the vision for the future, Dr. Alonto, as far as infectious diseases? We know we're going through transitions of administrations and all that. So I know you can't really talk specifically about that because we don't know anything yet about how things are going to roll out. But people should probably still be aware that these vaccinations are important. Um, and for infectious diseases, what should people be concerned about? I see some people wearing masks out there, some are not. People are sort of confused right now. What should I be doing right now? So, what does the CDC recommend, and what's the way forward for people, going into this season right now?
Yeah, so basically, the CDC currently recommends that if you're symptomatic, if you're having symptoms, then you should probably be wearing a mask to protect others, especially when you're in the hospital. And if a patient tells me that they would prefer that I wear a mask, I wear a mask because masks can also save lives. It's been shown that wearing a mask can prevent transmission of many different viruses from one person to another, especially during the holidays when we are indoors and when we interact with many different people in close contact with different people. Masks can be beneficial, especially when different respiratory viruses are circulating in the community.
Yeah. And probably the best way is to make sure you get vaccinated so you minimize
Definitely,
your risk of getting sick. To begin
definitely.
because one of the things I mentioned to someone before was that, if you could still be asymptomatic, have no symptoms at all and carry the virus and potentially spread it. And if you go to visit someone or, and they have a child that's sick or someone who has cancer, you could be the harbinger of death for them. I mean, if you are not taking care of yourself, if you're not vaccinating yourself, and it's not just protecting yourself, it's protecting everyone around you as well. So people need to have that more of a communal consciousness about how they are conducting their lives as far as taking care of their health.
Yeah, that's a great point, Dr. Arnold. It not only protects you, more importantly, it protects other people too who are vulnerable.
Yeah. And so, as far as the lung cancer, because that's one of my pet peeves about smoking. I, you know, I grew up in an age where they had doctors smoking on television. and, and everyone. It was a big push for the cigarette industry, and there was a big push back against, oh, cigarettes really don't cause lung cancer, and so we had to go through that phase of things. Um, so, what can you tell people about the risk of smoking right now? Especially we're in a time period where um, people seem to be a little bit more health conscious about eating. It seems like people are starting to get that message, but um, there is a correlation between what the food industry did and what the cigarette industry did. Actually, the main campaign group that was working on the cigarette industry works in the food industry as well. So there seems to be a need to get that message across. And what can you tell people about what you see when people come in who've been smoking chronically? There are some people who have to have oxygen as well, supplemental oxygen in order to
Right.
get by.
Yeah, I see this all the time on the scans that we get on people. There's no safe amount of smoking. Any sort of smoke that's entering our lungs can cause damage, especially over long periods of time. And lung cancer is really just one small part of the problem of smoking, as you said. It can cause so many other health problems aside from smoking. So when we get these scans on people that have smoked, sometimes we often don't find lung cancer, but I will see holes in the lungs caused from emphysema from smoking. And that damage is not damage that will ever get repaired. So, the number one thing people can do to reduce not just their risk of lung cancer, but to reduce further harm to their lungs and prevent further damage to their lungs is quitting smoking. It's extremely hard to do. Nicotine is so addictive. And it's not uncommon that people try to quit and fail, but there's so many resources at the VA that we have to really help people with that quitting journey. And I just try to remind people, very few people quit on the very first try. It often takes multiple tries at quitting, and it often takes help too. Help with medication, help with just support, social support, and things like that. So it's not easy. We know that. Anything that people can do to reduce the amount helps. And then ultimately, anything we can do at the VA to help you finally totally quit, that's going to make the most improvement in your health in the long term.
Well, Augusto and Catherine, I know where both of you live, so you'll be back on again. You can't get away, but but we have a few minutes to go, so I'm going to give you. We actually have about 1 minute, so I'm going to give 30 seconds to each of you just to say one thing you think is really important. Dr. Alonto, head it off.
Yeah, so as the holiday season approaches, it's really important to get vaccinated, especially for the flu and the COVID vaccine for this season. So go to your doctor, go get it, go to the VA. We have it here for free.
Okay, my nurse practitioner Dell, who's doing a great job with lung cancer screening. Say your piece.
Lung cancer screening saves lives. If you smoke or know somebody that smokes, talk to them about lung cancer screening and come get your scan.
And it's been a great pleasure speaking to both of you, and thank you so much for what you do for our veterans. They sometimes they have no other place to turn, and what you do is nothing more short of being miraculous itself. The kind of care you give, but also the compassion that you show to our veterans and people who served our country. Thank you both.
Thank you so much.
Thanks for having us.
Mhm.